Story 1. I live in a country with universal healthcare. Here are my brothers and cousins' responses when I have discussed this with them. I earned my money, and I don't want to pay for someone else's expenses. Both of them are firstborn sons from a traditional East Asian family and stand to inherit considerably when their parents pass away. My brother, being the only son, has more to gain. My parents have informed my sisters and me that we will not inherit anything. According to my brother, he earned all his money, and no one else should benefit. Story 2. When referring to a hypothetical family exposed exponentially more to the negative effects of industrial and environmental damage, my coworker said, "Let little Timmy die. Some people just do not care enough about a random stranger." Story 3. The United States spends more per person on healthcare than any other nation and ranks 56th in quality of coverage. The real question is why anyone supports a system that costs more and causes avoidable trauma, financial ruin, and death. Story 4, to paraphrase, they should all die quietly except when my family or I am personally affected, and then we should receive everything free forever. Story 5. I used to be strongly opposed to it, believing that everyone would essentially become lazy and take advantage of the system, thereby overwhelming healthcare resources. Now, following the Affordable Care Act, the resulting political confrontations, and the COVID-19 pandemic, we face a situation that combines the worst aspects of both universal and privatized healthcare. People are earning $15 to $20 per hour while facing deductibles exceeding $4,000 and 30% copays for their families. Healthcare providers charge $100 for a throat swab, $100 for a COVID-19 antigen test, and $200 for a stitch, all while overworking nurses and doctors who have to see a new patient every 12 minutes. Why does this occur? Simply because it can happen. I am unsure what the solution for healthcare in America is, but the current system is unsustainable in any form. It is completely broken, and every action is driven by profit motives. I hope that the best and brightest from both sides of the political spectrum can set aside their differences, unite, and work towards better solutions. Story 6. Actually, the reason I used to oppose it was that I didn't want the nation to be bankrupted by paying millions per patient for a few years of often demented, painful life. It turns out the sticker prices of medical care, such as $200 per stitch, are just gouging and not the actual cost. Additionally, the miserable sick people are still covered by Medicare. It's just the quality of life that doesn't seem to matter. Story 7. I am not opposed to exploring different healthcare systems, especially coming from a country with some of the most comprehensive nationalized medical care in the world. However, the question remains unanswered. Many individuals in the United States who resist government-sponsored healthcare, particularly those who are well-informed, believe with some credibility that if the system functioned as intended, which it does not, it would be more affordable, which it is not, and would provide greater freedom and control over personal health, which is not the case. There is a scenario where the United States healthcare system could be viewed as better than a nationalized system, but it would require a level of coercion towards every insurer, pharmaceutical company, and healthcare provider that the U.S. government and its citizens are ideologically opposed to. Unfortunately, privatized healthcare often undermines itself. Story 8. The arguments I hear the most are, 1. It would require raising taxes, and I do not want to be responsible for other people's problems, with the assumption being that these problems are the individual's own fault. It will bankrupt the nation. They often reference Greece while ignoring other countries that have universal health care. Longer wait times increase demand, putting a greater strain on the medical industry. Social programs promote laziness. They typically make a slippery slope argument regarding this issue. Lower quality of medical care is often cited. People claim that government involvement makes everything slow, annoying, and tedious, which is why they are against large government. More people would misuse the medical system and seek unnecessary treatments. Story 9. It's hard to address any question like this on Reddit. The platform tends to be close-minded and shuts down any real answers. I want to add that I am not currently opposed to universal healthcare, but there was a time about 20 years ago when I was. The answer to your question is that I honestly believed it was a necessary evil. I thought that more people would die waiting for healthcare than would be saved. I believed universal healthcare would likely overwhelm the healthcare system and make it less profitable for doctors, resulting in a lower quality of care and extremely long wait times for services. I thought this would cause more deaths overall than our current system. I still believe that there will be some trade-offs that many on Reddit seem to refuse to acknowledge. I think that some of these concerns will likely happen. However, given how broken the current model is, I believe universal healthcare will still be a significant improvement over what we have now. I will also admit that I had much more faith in capitalism at the time than I did in the United States government. I thought industries run by capitalists tended to work better than state-run ones, such as FedEx compared to the United States Postal Service. I also believed that wealth was more earned than I currently do. While I didn't think it was perfectly fair, I believed that, as a general rule, people earned more money the more they contributed to society. Therefore, I felt a wealthy person's life was genuinely more valuable than that of a poorer person. I still have little faith in the United States government, but my faith in capitalism has diminished significantly. Story 10. I oppose universal healthcare because I believe that aliens should not take precedence over humans. However, I support socialized medicine. Story 11. Sad but true, 650,000 citizens of the United States go bankrupt each year due to medical costs. Meanwhile, the current president spends millions on golf at his own resorts. Story 12. My dad is opposed to it because he believes that those less fortunate than he deserves their circumstances. He thinks they are suffering because they want to be, and that they choose to be poor and unable to receive care. I despise him. Story 13. I no longer think this way, but for a while I was against it for the following reasons. I believe that beyond the three inalienable rights, life, liberty, and the pursuit of happiness, the government had no right to enforce anything upon its citizens, including taxation to pay for unnecessary luxuries. I was influenced by various forms of propaganda, such as claims that my taxes were used to educate strippers in South America or that lazy individuals would use taxes to avoid work. This was the usual fear-mongering, racist, and ableist rhetoric, and I believed it. I thought it was morally wrong for the government to take my money to facilitate such corruption. Ultimately, my change of perspective came from living and talking to people from different walks of life and developing empathy. There's also a fair bit of logic in figuring out where the corruption actually lies. However, what really changed my mind about healthcare specifically was someone pointing out that healthcare is part of your right to live. If you are dying and can be saved, don't you deserve to live simply because you are a person? If you require medication to live, like insulin, are you truly paying for your right to exist? Furthermore, to afford this, you need insurance, which is almost exclusively provided through employment. Is it work or die a preventable death? In this sense, are you not a slave? Are you free? This experience started me down the path of radicalization, and now I identify as a progressive. Story 14. My brother is on the state version of Medicare. He got a small cat bite and thought nothing of it, but it went septic in less than 8 hours and he was in the hospital for 3 days. Had he not been covered by the state, I wouldn't have been able to pay for his emergency room visit. Story 15. I need to state that I have been treated for serious medical issues in the United States, the United Kingdom, and France. The United Kingdom was by far the worst. However, that is not a genuine aspect of universal healthcare. It results from intentional underfunding and mismanagement by those who seek to privatize the system. I have known people treated in other countries with universal healthcare who did not face nearly the same issues. Of the three systems, the French system was absolutely the best. With regulations to keep the costs of medicine and procedures down and a two-tier funding system, everyone living in the country can apply for a health card, and with this, the government covers 70% of their healthcare costs. Insurance exists but is tied to employment, with employers covering the cost. There are no co-pays or deductibles. I went for a while without a health card but never paid more than $700 for a procedure as the full uncushioned cost for surgeries I had undergone and thought I would be paying off for the rest of my life when in the United States. The United Kingdom is difficult, but a significant part of that difficulty stems from staffing and resource allocation, along with the extremely limited number of spots in medical degree programs compared to the demand. The post-Brexit situation has also harmed staffing, as many who worked in British healthcare were from Europe. This shift has led many healthcare professionals to move to other parts of Europe and has disincentivized new migration of skilled medical workers due to the undercurrent of xenophobia that the referendum exposed. In the United Kingdom, if you need something to save your life from immediate danger, you will receive it at no cost. However, if you require comprehensive preventative healthcare, whether through universal or private means, which do exist in the UK, you likely will not receive it, or you will not get it in time for it to be effective at preventing emergency treatments. In every general practice I have attended in the UK, there are leaflets and posters detailing the symptoms of sepsis, with statistics on how many people in the UK die from sepsis each year. Sepsis, the end stage of an untreated bacterial infection, is one of the few conditions for which we have developed simple and effective treatments, primarily requiring a timely visit to a doctor who will take you seriously. Story 16. It is surprising how people claim that universal healthcare is too expensive while being completely fine with unexpected $20,000 emergency room bills. Story 17. The American healthcare system is fundamentally broken. No individual should be denied care or suffer because of an inability to pay. The solutions to fix this issue are as complex as the problem itself. I hope for a world where everyone has access to evidence-based healthcare. Story 18. It is funny how people who oppose universal healthcare and explain their reasons somewhat rationally get heavily downvoted for the opinion that the question specifically asked for. Story 19. Not opposed at all, but curious about the comments. I am a pre-med student and have been told by physicians that if we were to switch to universal healthcare, they would not make as much money. In fact, I know one physician who moved from his home country with universal healthcare to the United States for that reason. To me, as long as I can eventually pay off the student debt, I do not need the luxury. Yes, it would be nice considering the amount of responsibility and experience, but I am pursuing this field to help people, not because of the salary. The fact that our government is tampering with Medicaid and Medicare infuriates me. What good is it to me to have the ability to help people but not be able to do anything due to insurance? I swear if the medical path does not work out for me, the law path might be. Story 20. This answer to the question may be simpler than you think. There is a bias in our minds that leads us to believe that all good things that happen to us are a consequence of our effort and good choices, while bad things that happen to us are due to bad luck or the actions of others. For other people, we tend to think the opposite. Their achievements are due to luck and help from others, while their failures stem from a lack of skill and poor decisions. Now, if we apply this to healthcare, it is similar. People believe that whatever health problem they have should be a top priority because they don't deserve it, while other people's problems are seen as their own fault, and those who believe this do not want to pay for them. Private healthcare systems exploit this bias, suggesting that individuals should pay for their own healthcare instead of contributing to the care of others. People struggle to comprehend large numbers, whether it be money, population, space, or time. Our brains are simply not designed for this. You can present all the evidence showing that costs are lower and population health is better with a universal system. Yet our primitive instincts will still insist, I'm not going to pay for others. Story 21. I think a common argument for many people is the idea of having to pay for someone else's poor choices. For example, it is frustrating to cover the healthcare costs of an obese smoker who has significant expenses due to their lifestyle choices. I understand that perspective, but the point that gets overlooked is that universal healthcare is cheaper overall. Early and frequent access to care can help resolve many issues before they become overwhelming and expensive. People need to move past the notion of wanting to pay only their fair share and recognize that collectively supporting everyone is ultimately better for all, regardless of how fair it may seem. Story 22. These are not the only two options. I used to support universal healthcare until I became a Medicaid provider. The government requires a lot of information and then dictates the treatment. Private insurance has far less overreach. I still believe healthcare should be affordable for everyone. I just disagree with the current approach. First, we need to cap prescription drug prices. We subsidize the rest of the world simply because our government allows it. Second, we need an overhaul and expansion of the Affordable Care Act. I get my insurance through the marketplace, and while it is decent, I pay over $500 per month for it. That is not affordable for most people. Third, we need to give providers more freedom to dictate care. They are the experts, not the government. Lastly, we need to expand Medicaid to cover a wider range of people. It is not perfect, but it is necessary. Story 23. I do not oppose universal healthcare, but I am not in favor of it either. A smart plan needs to be presented because it feels like it is masking the real problem: the insurance companies and price gouging. A $20,000 ambulance ride to the hospital should not be a burden on the government when the service should not be that expensive to begin with. Story 24. Your question presents an all-or-nothing scenario. There are gray areas possible between a completely private system and total national health service. Story 25. If universal healthcare is already in place, it is much easier to fix than a capitalist healthcare system. Short on doctors? Ask Congress to increase wages. The same situation in a capitalist system would require the consent of majority shareholders or chief executive officers foregoing their bonuses, which is unlikely to happen. People in for-profit healthcare systems spend significantly more money than those in single-payer health systems, and it does not guarantee them better quality or even access. When profit drives the development of a healthcare system, there is little investment in poor, rural areas because those populations are small and less profitable. If healthcare were provided by the government, there could be requirements to ensure the same quality and access to healthcare in rural areas as in metropolitan areas. More individuals are denied care due to inability to pay in for-profit systems than in single-payer systems. If anyone is denied care, regardless of the reason, it is concerning, but as mentioned, it is easier to address in a universal system. The amount of time people spend engaging with insurance companies to utilize the benefits they pay for is an often overlooked cost of healthcare. Almost every visit or billable item related to each visit gets denied. I spend about 45 minutes on hold with insurance, get transferred multiple times, and hold again, just to obtain the information I need to convey to the doctor's office billing department to have it corrected and mail the information, along with a persuasive letter requesting an appeal, all within 30 days for each item. Everything gets billed separately. That's hours of our lives we will never get back. Wealthier individuals can afford to skip this process, but those who often work multiple jobs must spend their limited free time arguing with insurance in a system designed to extract every penny of profitability from them. More than an uneven playing field, this situation resembles a cliff. Story 26. I will explain why I believe that universal healthcare does not help those who currently cannot access healthcare in the private sector. The original poster seems opinionated, so hopefully we can maintain a civil discussion. My family comes from a country with universal healthcare. Everything seems better from the outside. They have people dying because it takes years to get appointments. Additionally, it can be cheaper for the system to let patients die, so doctors may do nothing. There is no incentive for them to be competitive, as the government pays them regardless. Consider the United States Department of Veterans Affairs health system. It is a total mess with people dying in waiting rooms. My husband had an emergency, and they scheduled him an appointment 5 months away. We had to resort to one of those cash-paid emergency care facilities. Our current system is broken. My adoptive mother is dying from cancer, and we cannot do anything about it. She does not qualify for Medicare, and after all the money we invested in insurance, they do not cover anything. We still have to pay, or we will face penalties. After trying to get insurance from the marketplace, all I achieved was nonstop texts from insurance companies. What needs to happen is not a shift from a corrupt company to a corrupt government, but rather accountability. Changing the name of the team does not change the players. They will just move to the government and continue the same practices. Story 27. Why do we give money to countries like Israel that have universal healthcare but do not provide it to our own citizens? Story 28. What I find ironic about our entire healthcare system in the United States is that the benefits are somewhat sensible. You pay more to receive better healthcare than others. It may even be better than anywhere else in the world if you are paying a lot. But the funniest part is that you don't necessarily get better care. You just pay more because companies can charge you whatever they want, even for inadequate care. I'm fortunate to have good insurance, but it is shocking to see my partner suffer from something concerning and not want to go to the doctor because it is too expensive or to undergo very few tests because they all cost hundreds of dollars each. That is just a mild example. Story 29. I have considered this matter, and it comes down to the belief that not everyone has the right to live unless they possess a certain amount of wealth. This perspective suggests that if someone cannot afford health care, they do not deserve to be alive. It is as straightforward as that. I wonder how these individuals would respond if market forces increased this arbitrary threshold, rendering them below the line and deemed unworthy of life. Story 30. I'm currently in the UK. My partner went into urgent care after having a fever for several days. An ambulance took us from urgent care to the hospital, where he received multiple intravenous drips and underwent numerous tests. He stayed for nearly a week, and because they were testing for tuberculosis and suspected he might be infectious, he was placed in a private room with a shower. He walked out without paying anything, thank goodness for the National Health Service. I find it hard to understand how anyone could oppose such a service. Story 31. I want to know if those who oppose universal healthcare understand that it is more cost-effective. Surely, as taxpayers, they do not oppose that. Story 32. I do not believe healthcare should be free, but it should be affordable. We need our tax dollars to be utilized properly to fund initiatives like affordable healthcare rather than being spent on unessential matters. Story 33. It is always the same individuals who oppose it, and their argument consistently revolves around the idea that government-run programs could never work. They choose to overlook the fact that while not perfect, Medicaid, Medicare, and the Veterans Affairs medical system have all functioned for well over 50 years. If we invested even a small amount of effort into the system, we could make it the envy of the world. Instead, we have a situation that is uncommon globally: medical bankruptcy. We also have homeless veterans, which is a situation we should not take pride in. The problem lies in a general conservative attitude of indifference. They simply do not care about others unless it affects them directly. Story 34. People are going to die for lack of healthcare. An economy simply cannot support all the healthcare that people need. There are different ways to address this issue. I do not have a good solution. I observe that countries with tax-funded healthcare face challenges. Sometimes serious challenges such as long wait times for routine surgeries. There can also be overcrowded emergency rooms because individuals seek emergency care for minor issues since it is free. Additionally, there may be doctor shortages due to overuse coupled with low compensation. However, one aspect where private healthcare excels is innovation. Companies have a profit motive for conducting research. If America adopts a fully government-funded healthcare system, who will conduct medical research? Story 35. If you oppose universal healthcare, you must be willing to state that the ability to live should depend on your ability to pay, meaning someone's value as a human being is measured in dollars. If that makes you uncomfortable, it should, because that is not freedom, it is triage by income bracket. So ask yourself, is avoiding a slightly higher tax bill really worth someone else's life? Story 36. Because I do not trust the government to run a successful healthcare program. Additionally, I do not want to see abortions and other types of care or procedures denied because of religious lobbying. Transition care, hormone therapy, abortions, and stem cell treatment would all be prohibited. Story 37. I don't think anyone is opposed to universal healthcare. Only the most extreme individuals would say, I don't want everyone to have healthcare. The debate is about how to achieve this. I don't agree with this perspective, but an argument could be made that it isn't the government's responsibility to provide healthcare. Alternatively, one could argue that there are more efficient and cost-effective ways to ensure everyone has access to medical care without government involvement. It's a tired discussion that I don't wish to engage in, but I am merely outlining what some people believe. Story 38. The thing that surprises me is that most Americans dislike their healthcare, yet few want to explore new options. Many express dissatisfaction with their healthcare system but are resistant to the idea of universal healthcare, fearing a system like those in Canada or Europe. What is the problem with this attitude? People can be unhappy with their current circumstances but still hesitate to consider alternatives. Story 39. The principle. You do not have the right to products, goods, or services. You have the right to pursue those things at a fair rate, but not the right to possess them, because a right to possess them denies someone else their right to autonomy. Story 40. They are fine with it until their own family members get affected. Then it becomes a question of why certain political leaders made those decisions. Source: I am not personally one of these people, but I live in the South and know many of them, including my own in-laws. Story 41. All the arguments I have heard against it are problems that already exist unless you have a significant amount of money. Story 42. You are looking at this the wrong way. Because Americans have allowed themselves to be manipulated by the notion of socialism, they pay double the Organization for Economic Cooperation and Development average for healthcare while receiving health outcomes typical of developing nations. So the real question is, why are you willing to double your healthcare costs to prevent others from having access to healthcare? America right now is the cliché example of cutting off your nose to spite your face. Story 43. I support universal healthcare, but my family is very conservative and strongly opposes it. Their main argument is that universal healthcare leads to long wait times and fewer choices in providers. Meanwhile, I live in a state with limited healthcare options and am on a 15-month waiting list to see a specialist, all while having restrictive insurance coverage. On a different note, Thanksgiving dinners are enjoyable. Story 44. More importantly, our economy benefits from people being alive, especially if they live longer. If we are cheap and let them die, the initial investment and the return over their lifetime are lost. Story 45. Pretty good, Bob. Otherwise, people would demand change, as the United States medical system is the last great bastion of organized crime. Story 46. They say that a rich person's life isn't more valuable just because they are wealthy, yet poor people die from diseases all the time. Why aren't all AIDS victims treated like Magic Johnson? Something tells me he is paying for top-tier care that the poor will never have access to. Therefore, they are just left to die from whatever disease they have. Story 47. Firstly, what do you mean by universal healthcare? It may be achieved by allowing access for all and subsidizing private insurance while still being universal, as everyone has it at a price commensurate with their income. That's universal but not free. You still pay what you can. In general, the people I find that are against universal healthcare still want individuals who need care to receive it. They just do not want a single pool from which all services are funded, as in a monopsony. Story 48. Who dies? No hospital can deny you life-saving care based on your ability to pay. If they do, someone can take ownership of that hospital through a lawsuit. Story 49. Two people can look at the same problem and recognize that it is a serious issue, but they may have completely different approaches to solving it. Story 50. Cannot get care? By law, anyone who seeks care can receive it. You just have to pay for it. Regarding making care more affordable, I absolutely agree. However, I believe that a universal healthcare system is a poor decision, as evidenced by historical context. I believe fundamental changes to the current system, which continuously raises prices, need to be implemented to encourage competition and reduce costs. To some extent, the government has a role to play as a regulator and enforcer. I think insurance providers should be required to cover all necessary services, but there are reasonable arguments against covering behaviors that individuals willingly engage in that affect their health. Story 51. They don't care. Clearly, that's why we have the system in place now. But when it happens to them or their loved ones, then they learn. Story 52. The real question is why there is support for individuals aged 65 and older through Medicare, but not for those under 65. What is it about turning 65 that makes a difference? Story 53. I believe that those opposing some form of universal health care in the United States are either overlooking a critical issue or deliberately ignoring it. Even with the Affordable Care Act, there are still millions of people, primarily self-employed individuals, who cannot obtain health insurance on their own due to pre-existing conditions, having been dropped by a previous insurer, or being deemed uninsurable. Without a universal health insurance program, they cannot get coverage, which is a definite problem. In what way does it benefit the country for these individuals to be unable to secure insurance and, consequently, more affordable access to health care? How does this improve the situation? Story 54. I oppose the implication that if you are not fully on board with universal health care, you are in favor of people dying. It is not a matter of one or the other. Universal healthcare may sound like a great plan in theory, but do you trust the government to implement it effectively? I do not trust either state or federal government to competently implement universal healthcare, especially when each party seems focused on changing what the previous party did. The concept will fail unless our government works together, and I do not see that happening soon. This point is my main concern. Story 55. This post makes me sad, and I cannot read the comments. It will be completely filled with logical fallacies. I am not going to do it. I just needed to express that. Story 56. That happens with universal free healthcare. Where I live, it is supposed to provide free healthcare, but it still costs a lot of money. The only way I can see a doctor is if I go to another city and pay to visit a private practice. I will have to wait years if I want a free family doctor. I used to have a family doctor when I was 19. The doctor quit and was replaced by a nurse. When I would call to make an appointment, they would say I have to wait 3 months to see the nurse, and she cannot prescribe anything. Story 57. I oppose universal health care, but I support regulating medical costs and insurance companies to ensure affordable health care. I believe the government should not be in charge or use tax dollars for this purpose. Insurance companies often operate like organized crime, and treatment costs can be exploitative. I also advocate for promoting preventative health care. Just because some people do not support government-funded universal health care does not mean we do not care about others or want them to receive treatment. It simply means we believe there are better ways to achieve these goals. Story 58. Because that doesn't happen in the way most people think. Medicaid exists, and the state and federal government is obliged to provide the standard of care to all patients. People who don't prepare or invest in their own health certainly suffer when they suddenly need help. The state will provide Medicaid once all personal expenses are exhausted. If I invest in a premium healthcare plan versus someone else who chooses to spend that money elsewhere for years, why is it suddenly my problem when they're held to the terms of the contract they signed? Many people choose to spend $200 a month instead of $400 and forego long-term coverage. Why is that my problem when they suddenly need it? And please don't say, it should just be covered under a total package. Obviously, there would be a substantial increase in personal taxes, and universal healthcare would take more money from upper middle and upper class pockets. At this point, however, my position is that universal healthcare is necessary because too many people lack the discipline to make the right choice on their own. Americans are too caught up in living fantasy lives way above their means. Everyone likes to pretend they're rich until they can't anymore and then cry that it's the system's fault. Story 59. While I could be convinced of some reforms, universal healthcare introduces a moral hazard. If there is no cost to seeing a doctor, the increased use of medical services could overwhelm the healthcare system. I would prefer to support a more market-oriented approach by significantly increasing the cap on residencies, which is a form of rent-seeking by the American Medical Association, leading to American doctors being paid significantly more than their counterparts in other countries, consequently driving up costs for everyone. Story 60. Universal healthcare has both advantages and disadvantages. It's important to note that people still die even when they have access to it. Do you believe that the goal of universal healthcare is to prevent individuals from dying? Story 61. I used to know a libertarian who was against visiting the doctor because they insisted that health was a personal responsibility. Story 62. Everyone who highlights the poor service from government agencies is forgetting one important thing. When those agencies were first created, they were effective. They improved American lives significantly and made them easier. However, a certain political group did not appreciate this. They made it their mission to undermine and destabilize these agencies so they could point at them and say, "See how poorly this agency runs? Do you want the government managing essential services for you? This is misleading. They want your tax money to go to the military so it can be misused through unnecessarily high-priced necessities and contractors, returning to their own interests. Somehow, we can trust them to manage the military but not our health care. When agencies are properly funded and have strong regulatory oversight, they can operate just as effectively and smoothly as any privately run company. The inefficiency is deliberate. Story 63. I believe the answer is something like, they should have worked harder, saved more money, or made better choices, completely ignoring that unexpected events can occur at any time, from before birth to after one has passed away. Story 64. Basic necessities such as healthcare, housing, and education should be universal. The current system attempts to exploit people. Story 65. I recently had a conversation on a related topic. I pay about 16% of my gross income for health insurance and slightly more than that in taxes. For that 30%, I would be fine if I still had health insurance and the rest of the country did too. The biggest point I want to make is that I would much rather the government spend the approximately 19% that they take on healthcare, social safety nets, education, and similar areas instead of engaging in military actions around the world. I am fine paying for it, whether privately or through taxes, but I want my money put to the best use possible in helping citizens of my country, not in causing harm to people around the world or participating in global political conflicts. Story 66. If money determines who lives and who dies, then healthcare is not a system. It is a business with blood on its hands. Story 67. The pro-life party only cares about unborn babies, not actual human beings who need help. They are only pro-life if it does not cost them anything. Story 68. I forget which television show it was about 15 years ago. It was the town forum type with a few average people making up the audience and the host asking questions. I believe the topic was healthcare and insurance, or maybe it was just one question. Pretty much what you ask. What should those who are sick but don't have insurance and can't afford a doctor do? A guy in the audience yells, "Let them die!" And a few more cheer in approval. There are many people who truly believe that this is how it should be in the richest country in human history. The hypocrisy is that many of them are the very ones who don't have insurance and can't afford a doctor if or when they get sick. They have been indoctrinated to believe that any form of non-private medical insurance is communism or socialism and therefore inherently bad. They vote for those who will let them die when they get sick and then blame the liberals for their problems. Just like what is happening with the economy. The oncoming recession is being created by those whom they voted for, but they'll blame it on the current and past Democratic presidents. Story 69. Because the United States treats medicine like a business and a commercial opportunity, the situation is dire. In comparison, the United Kingdom is currently facing challenges due to decades of politicians attempting to align healthcare with practices seen in the US, but we still have the National Health Service for now. Medicine in the UK costs significantly less than in the US because the National Health Service has sole importer status. If American pharmaceutical companies want to sell in the UK, they must agree to the rates that the National Health Service is willing to pay. They do not sell at a loss. They simply do not sell at a massively inflated profit. Insulin is a perfect example. In the US, insulin can cost hundreds of dollars per dose, while it was originally created in the 1920s, and the patent was sold for $1 to ensure it was available to everyone who needed it. Insulin has existed for a long time, and the production process is well understood. Each dose of insulin costs around $2 to $4 to produce, leading to an almost 100 times markup. The usual explanation given for the inflated prices is the cost of research and development. However, as noted, insulin was already developed and made available for pennies over 100 years ago. Therefore, there are negligible research and development costs associated with it. Another argument is that the free market drives innovation. While this can be true to some extent, it is also misleading. The free market primarily drives profit realization, not genuine innovation. There has been a growing trend toward developing symptom management drugs instead of cures. The logic is that if they cure you, they lose a customer, but if they manage your symptoms, they can keep you sick and continue charging indefinitely. This was even discussed at a notorious conference among major pharmaceutical companies, where they argued that trying to treat AIDS was a poor business decision. Thus, the US healthcare system prioritizes profit over public good. They develop drugs that actively avoid curing patients and inflate prices astronomically, using nonsensical justifications. In reality, they are taking advantage of the public over a product that is essential and sometimes life-preserving. In any other country, this would be considered monstrous and deeply illegal. However, American pharmaceutical companies are increasingly influencing other countries with this mentality and are doing significantly better than one might expect because financial interests often sway politicians, who are vulnerable to lobbying. Ultimately, none of this needs to be this way. People are suffering so that a small group of individuals can accumulate immense wealth. Story 70. This question may be simpler than you think. There is a bias in our minds that makes us believe that all good things that happen to us are a consequence of our effort and good choices, while bad things are attributed to bad luck or the actions of others. For other people, we tend to think the opposite. Their achievements are due to luck and assistance from others, while their failures stem from a lack of skill and poor decisions. When we apply this to healthcare, it becomes clear. People often believe that whatever health problem they have should be a top priority because they do not deserve it, while they see the problems of others as their own fault and do not want to pay for them. Private healthcare systems capitalize on this bias, suggesting that individuals should pay for their own healthcare instead of contributing to others. People struggle to understand large numbers, whether it be money, population, space, time, or other metrics. Our brains are simply not designed for this. You can present all the evidence showing that costs are lower and population health is better across a universal system. Yet our ingrained biases will still lead many to say, "I'm not going to pay for others." Story 71. The best way to look at it is to assume they do not see us as people. We are all a means to an end, and they scare their voters into thinking the same thing. They do the same with the LGBTQ community. They have to dehumanize, and the rest of the conservatives allow them to do it and join in. Story 72. The important thing is that if people are not dependent on their jobs for healthcare that they or their family may need to survive, they might not tolerate as much from their employers. It is much easier to confront a difficult boss when you don't have a spouse who needs insulin or other essential medication to live. This is also the reason why the United States has significant issues with unemployment and welfare. People are much more exploitable when they cannot survive without a job. It benefits the wealthy that the less fortunate often struggle to make informed decisions. Story 73. My staunch Republican father-in-law says, "No one is dying because of lack of health care." He only watches Fox News, of course, where it is never a problem. Story 74. I do not think I am your target audience, but I oppose universal healthcare as it has been nationalized in other countries. I do not believe it makes sense for America. However, I do not think healthcare should be tied to employment, nor should citizens have to go bankrupt due to medical necessities. I support universal health insurance, where everyone contributes to a system similar to Medicaid, and negotiations are conducted through that single provider, which would lower costs. This approach allows for competition, as healthcare can still be owned and operated by private companies, while ensuring everyone has access to the help they need. Story 75. I think you are conflating universal healthcare with a single-payer system. They are not the same thing. Universal healthcare is a goal. A single-payer system is one proposed solution to achieve that goal. I do not support a single-payer system in the United States. How anyone could want a former president and the Republican Party running their healthcare is beyond my comprehension. Why would you want the government, which is often run by extreme regressive elements, to have that much power in your life? I want universal healthcare. I do not want a single-payer system, and it is revealing that those who claim to care the most about this topic cannot even get the basic vocabulary right. Story 76. I know a highly respected doctor in Virginia. She had a top job working with the government and received great pay. She married someone I knew, so we spoke quite often. When we discussed the National Health Service or healthcare in America, she mentioned that she didn't want to pay for anyone else's care, as she had struggled to get where she was. That was quite a shocking revelation. She had been so nice and considerate up to that point. I didn't speak to her much after that. Story 77. The fundamental problem with the healthcare system in the United States is that it operates as a for-profit system. Until we address this issue by removing the profit motive, it is not fixable. There are simply too many parties involved that want to maintain the profit stream. Story 78. I am not opposed to it. I just belong to the camp of thinking, how are we going to pay for it? In America, at least, that has been a significant problem. When you factor healthcare into welfare expenditure, it is by far the priciest item on the agenda. Do not get me wrong. I believe our healthcare system is inadequate and could benefit from a complete overhaul. However, it is not realistic to think that our government could subsidize healthcare for 340 million people. It is already financially untenable as is. I have been on medical assistance before, and I can tell you that it is roughly equivalent to the standards that Europeans have with their socialized healthcare. I experienced 3-month wait lists for basic dental checkups, tooth cleanings, regular appointments with my general practitioner, and was still limited on certain procedures that required prior approval. Now imagine expanding that kind of coverage to every American in the country. Wait times would triple and quadruple. The lack of trained physicians to address all those patients would result in lower quality healthcare overall, and it would just be another issue for people to complain about. But that is not the conversation anyone wants to have. They just want more benefits without any accountability and will complain about the service should they ever receive it. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.